both at the same time. We're here. Good morning, my internet friends. Welcome to the Medicare Cafe pre-chat. We're logging on just a couple minutes early to I at this point I don't know to just spread chaos.
Spread chaos.
Exist. I am a sleepy moose. Last night I went and hung out with Kari's cousin at the Chiefs game.
Yeah.
For all of you guys that don't know this, Kari's cousin is a Chiefs cheerleader.
She's also my assistant,
right?
So that's how.
Yeah, but she's my bestie now because I casually stalked her. The people behind me probably thought I was a crazy person.
No,
because I'm like, there's like, well, because I would think that I'm watching this cheerleader zooming in and zooming in, and I look like a psychopath. But
jealous that I didn't. I probably never will.
Really?
Chiefs game.
Well, it was a lot of fun.
I'm sure it was.
Very sleepy.
Chiefs and a Royals win.
I got to see Jason Kelsey. He was there.
Oh,
no
way.
I love him so much. I didn't see Taylor. I heard she was there, but I was on the other side of the field.
So was their breakup fake?
I guess so. Who knows? Who knows what's real? Have you been hearing? This is important. You should hear this too. Okay. Have you been hearing about those weird noises that are all over the world coming from the sky, and scientists have no idea what it is?
Oh,
it's crazy. And there's like videos. There's like,
you heard the noise?
Oh, the door's open.
Weird noise.
Sorry about that. No, I haven't heard the weird noise. But it's basically like, well, I've like watched like a video of it. I don't know if anybody in Missouri, but like, I mean, like in Spain.
Is it like Starlink stuff, like Elon satellite?
No,
stuff?
like he's not taking claim to it. It's like a crazy like growl sound, even
from space.
Space growl.
This was the farthest thing I thought we were going to be talking about today.
Space growls. Have anybody text me if you're like, I don't want to talk about space growls on a live format, you can text me. That is my number at all times. You can see it is 10 o'clock, so we will get started talking about Medicare things. But text me if you heard about the space growls. It's something now that like,
I can't wait to look this up.
Truly terrifying.
I can't wait to look it up.
Yeah, I'll send you a video.
Okay. Please do.
Today.
It's 10.
It's 10.
Happy Tuesday.
Oh, and can you read that message you texted me last night of your agent, or not your agent, your client that was like, acting like a senior citizen.
Oh, I forgot I texted that to you.
That's really sweet.
So I was waiting for, I had a client just phone review yesterday, and I called him, he didn't answer. And like 20 minutes later, I was on another call, and I get this like transcribed voicemail that says, "Hi, Kari, it's Patrick. Oh my gosh, I was sitting here waiting on your call and fell asleep, just like a senior citizen. All right, anyways, hopefully we can reschedule. I hope I didn't screw anything up."
What a sweetheart.
I know,
like
it's
a
so
senior
funny.
citizen and fell asleep waiting on your call.
And he like just turned 65 this year, like just retired, and so
bless his heart.
Yeah,
he's not.
It was funny.
He's got to figure out his naps better. That's part of being retired.
Yes.
You got to really figure out your nap timing.
schedule.
Yep. Today, guys, speaking of nap schedules, I'm very tired. We're going to talk today about an Ask Me Anything episode. What does Ask Me Anything mean? It means that you have the opportunity. I am not a senior, but I relate. And Ask Me Anything means that you get to talk to both Kari and I, and there really is no other plan today. It's basically taking in questions. Ask us anything. Taking in questions either via the live chat feature or via text message.
We did get some good ones.
Yeah, we did have some people message in some questions earlier and just say, hey, these are the things that like I've been asking Vinny to know. So even if you guys don't love us and don't interact with us, we have backups. We have people to ask. So, anyways, before we get into the AMA, while people are messaging and typing and texting and doing all the different, this is all the thing. You know what this is? Dead one of these. I'm sorry. Anyways, tell me about. Have you seen that? And it's okay. It's like, what's this? I don't know, but here comes a flock of them.
No.
And then like, what's this?
It's a dead one of these. Oh,
what's this? Dead one of these.
I have not.
So
I have not.
deprived.
I have not seen any of those.
Okay.
That's World of the Wars for sure.
The
space growls.
How was your first week? It's been 1 week since October 1st. How's your first week going?
It's gone pleasantly.
Pleasantly well.
It has.
You feel like it's because you've been working so hard. Like prepping was like you were a doomsday prepper in the best way for this AEP.
And I think like I don't know. I think what's made the world of a difference is doing reviews by phone because they're
for the
shorter.
people in the back. Yes. Yeah.
I've only had 4 in-person reviews, and I've had like over 30 phone reviews.
That's awesome.
And like 10 minutes. Like,
That's the
and I
best.
even had an in-person review yesterday that lasted, it was 11 minutes, like in person. And she was like, okay, see you later. I was like, oh my gosh, I have 20 whole minutes.
What do I do? Well, that's I think like mistake that we make as insurance agents and people who are so knowledgeable. I call it the show up and the throw up. It's like you feel like you have to draw out the appointment. Like you feel like they need to know everything. I got to inform them of everything. If you're the one causing it to go that long, like it's not a positive experience for the consumer. Because like shopping for insurance isn't fun.
Yeah,
for anybody but us. Like
no, they don't want to.
They
like,
don't
talk
want
to.
to
I mean,
be
you have
there.
the few who like I do think just want to talk.
Teachers, lawyers,
But
ask every question and then.
No, it's gone surprisingly well.
That's
And
so cool.
I was like
I love
expecting. I was also nervous about WellCare, and it hasn't been an issue. Like I was expecting like, oh my gosh, over and over the first like 4 plans for people are going to be non-commissionable. Oh, almost every time. Well, there's been a few times where WellCare was significantly cheaper and I just told them stay.
Yeah.
I didn't even say anything else.
Yeah.
But I've been switching. Cigna's being great. Humana's been good.
Oh, that's awesome.
Like,
that's good
I mean, I know
hear.
it's only been a week, but WellCare hasn't been a stressor at all.
Well, that was actually, let's go ahead and talk about that because that was one of the questions that we got ahead of time was what are people doing with non-commissionable plans like WellCare? So not only is WellCare non-commissionable, but they're also not paying renewals this year, which is wild that they can do that. But they can, and we instead of focusing on, I think what a lot of we were really concerned what a lot of agents were going to do was going to just out of spite for WellCare rewrite all their PDP business. Even if it was still the lowest cost plan, even if it was still a good option for the client, just rewrite them all. And that's a lot of time spent chasing very small premium and a lot of time spent when it's not even a drop in the bucket for WellCare.
The first thing we did is we went through, okay, who are all my WellCare clients who take no medications? We reached out to them immediately and we're like, just stay put. Like those we spent half a minute on. Just getting those out of the way. But everybody else, like unless it's like a drastic difference, like they've been switching.
Well, that's awesome.
Or want to switch. Obviously.
They want to switch. And so
anything. But
one of the questions is we've gotten a lot of questions about both E&O. Can I enroll in non-commissionable plans? What does that look like? So
I don't.
So, I mean, that is something to consider. I know what a lot of agents are doing are saying if an agent or if a consumer wants to enroll into a plan that is non-commissionable for me, then I'm going to send them directly to WellCare or to Medicare.gov. So that is an option that people are doing. And again, I don't see an issue with that. The one thing that it's a double-edged sword, right? Because you're saying, hey, I can't help you with this. I can't service you with this. If you want to enroll it, you're on your own. I'm not going to help you with this. And I think that's completely fine. And I think that's totally valid and probably, honestly, what I would do. There's also this other camp of if you go and do this yourself, then am I eliminating value? Am I showing that I am less valuable as an agent because you could do this on your own if you wanted to, which isn't necessarily true because you're still helping them shop for the plan. You're still helping them pick that plan. So that's, I don't know, it's a double-edged sword of like, where is my time well spent versus value of an agent?
I think it just like logically to me, if I'm telling somebody, they're taking the agent out of this. So like, I can't be your agent anymore. So, but no, I can still enroll you. Like that to me is confusing from the client's mind.
That's so fair.
So at least, and this is some way that I think I've gotten people to switch is I'm like, they're cutting the agent out of it. So I cannot enroll you in this. I can send you the links of where you can enroll. Or if you want me to do the enrollment for you so you don't have to do anything, you might have to pay $20 more a month. But here I can do this. It doesn't make sense to me to say they're cutting the agent out, but let me still do the enrollment. Like that's confusing. So that to me.
Yeah. No, another option, because I agree with you, because it is kind of talking out both sides. And it is,
Right.
to say that WellCare is cutting at the agent financially, yes, they are.
Yeah.
And they say, if I'm not going to pay you for it, then that's a pretty strong, I'm
Right.
cutting you out. But they are still allowing enrollments. They are
Yep.
still allowing that. But, like, I'm not arguing with you. I think that's probably how I would do it
Mhm.
if I were in your situation. Another way that you can do it is by going to your Medicare Center account and just emailing them or texting them the WellCare
Oh,
link.
yeah.
So with a lot of questions right now being having about
I heard about
non-commissional
that.
plans, because this is a new year. These third-party platforms like Connecture, Medicare Center, Sunfire, they've never done this before. Where they're allowing enrollment into non-commissionable
Non-commissionable.
plans. Before you were not allowed to per the request of the carriers. This year they are. So they are doing it to where, like, a non-commissionable plan, if a client gets a hold of your PAW, that non-commissionable plan will not show up on your PAW. Like, will not show up on your plan enroll website.
Okay.
But it will show up when you're quoting and doing all that stuff. When you're doing it like a face-to-face appointment, it does show up there. So you're able to quote and enroll non-commissionable plans. And if you just want to send somebody like an Aetna link or a WellCare link because you don't want to take your time for them, be like, yes, this is the plan they need to be on. Yes, I want to be AOR, but I'm not going to spend time with you in my office doing this.
Right.
You can text them that link, and it allows them to enroll themselves as well. So that is another option. Keeps you in the realm, keeps you AOR. You just got to be careful, because whenever you become, I'm thinking and talking at the same time, and it's very dangerous. I am so very sleepy. I did this before. Okay.
Space growls. This is one for the book.
Space growls. So if you enroll somebody and you are the agent of record, and they're saying, I'm not going to service it, I'm not going to help you with it, I'm not going to do anything with it. If they have a question on it and you've set the standard that I'm not helping you with your PDP, so they call the carrier or they call WellCare or they call Medicare, that's a complaint Medicare against you. Because when they do that, when a person calls Medicare and asks a question about their coverage, that is considered a complaint to Medicare.
But if you're not the agent listed, how do
So
they
I'm
know?
talking about, like, if you were to do it to where you are signing.
Oh,
You are
if
signing
you're
up.
signing it up.
If you're
for the
signing that, if you are the
non-commissionable.
AOR, if you're
Got
doing
it,
that
got it,
and you're
got it.
saying, don't call me for help because, girl, I'm not going to, and they call
Okay.
Medicare, that is the
Yeah.
complaint to Medicare.
Yeah.
So a point to send them directly to WellCare.
Yes. Yeah.
And I have an agent. I love him so much. He's a watcher of us. A lurker, if you will. Michael, he said, he goes, I'm sending all of them. They're doing it. I'm having them call WellCare directly. One, they can see what it's like to deal with the carrier directly and not deal with me. And two, I'm going to do whatever I can to have WellCare use every resource that they have and figure out this is why you need agents. Support it.
Give it back to them.
So that's what he does. Don't send them to 1-800-Medicare. Have them call WellCare. See what it's like to not have me in the process. Snap, sisters.
Mic drop.
Mic drop. So that was one of our questions, is what are people doing in non-commissionable plans? Those are kind of the two that I see. Medicare Center using tech to enroll them, or Medicare.gov sending them direct to the carrier as well. We did get another question too about service area reductions and what's going on. This is the biggest year that I've ever seen on service area reductions. I don't think there has been a major player that has been untouched with service area reductions. We're talking a lot of people.
Yeah. I haven't had any of those meetings yet, but I think
where people are losing that
people
coverage.
are losing it.
Yeah. And I think the question is like, what's the opportunity here? I think it's what a lot of people are asking.
Plans. Yeah. Yes. I've met with PDPs on.
Right.
But
all that whole thing.
Is that even considered a service?
For the PDP side,
no,
because it doesn't
guarantee anything.
Yeah, it's not a guarantee for Meds Up.
Yep.
No.
So yeah, I'm curious to see what these three tell them. You can have a guarantee issue because 2 of them are in Kansas. So
I'm not saying that anybody. I'm not saying us as agents think about the money and don't think about the person. I'm going to be very clear. I think all of us are always going to do what's best for our clients. Keep in mind, it's guarantee issued, which is usually like a one-time $25 commission.
Not all of them. Some of them.
Most. For GI. For GI, if you're going to GI somebody into a Medicare supplement, again, if they need to be on a Medicare supplement and this is the only way they're going to be able to do that, then do it. And it's also important to note that, like, If somebody qualifies for a guarantee issue and you ask them and you underwrite them anyways because you want the commissions, that's a DOI violation. You cannot ask somebody medical questions if they are guaranteed issue for a plan. So like they're like, oh, well, I'm gonna put them on a plan G because they're eligible after 2020. I'll just go ahead. I know like they want to be plan G. Let me just go ahead and underwrite them, and if they don't pass through underwriting, I'll just submit them GI. That's a DOI violation. Don't do that. But you could underwrite them to a plan N if they're interested in an N, because N is not a guarantee issue plan. But if you're going to guarantee issue somebody from a Medicare Advantage into a Medicare supplement, your commissions will be greatly affected. Just keep that in mind. It is if it's the right thing to do, you got to do it.
It would be the same carriers that pay for a MoGI though.
Oh, they look at those completely different.
Really?
MoGI and guarantee issue. Anytime there's like a birthday rule or a birthday rule or policy anniversary rule, those are normally not paid the same as guarantee issue.
But on like, because on the like the sheets that we have, it just breaks it into like IEP or GI or under 65.
We have spreadsheets that are specifically for Missouri because that's our most popular one, but they break down as like what each carrier pays for Missouri anniversary versus guarantee issue because they are different. Most ones will have it different. Usually some carriers will say like we'll give you more commission for Missouri anniversary, but the guarantee issue is only like $25 or a really, really low rate. Okay. So double check that. Yeah, double check that because it's likely to hurt your commissions to do that, but you got to do what's right by your client.
Right. For sure.
But just keeping in mind, if you do have a lot of people who are experiencing SARs, then you will have an opportunity to write them between December 8th and February 28th.
Oh,
so
February.
Yes. Well, and the thing is, if you wait, the mower's back. Why do they mow at Tuesdays at 10?
Tuesdays at 10.
If you do wait, you don't want to wait until January because then they wouldn't have coverage. A plan. What is my hair doing? I'm so sleepy. Then they won't have coverage. But if you an aggressive lawnmower,
very loud.
It sounds like I'm doing heavy metal with my
Somebody confirm that they can hear that, and that's very loud. It seems very loud.
Just give him a moment.
A weed eater.
It is a weed eater. Give him.
My mother-in-law calls it a weed whipper.
A weed whipper? You got yourself a weed whipper?
I think it's funny.
It's cute.
So cute.
Weed whacker.
Weed
I
whipper.
think my mom calls them weed whackers.
Weed whackers.
You get yourself a weed whacker.
I heard of a weed whacker, not a weed whipper.
That's a new one. A weed whipper I've never heard of. Anyways, but you want to make sure but it does extend your AEP.
Yeah.
To do that as well.
Good to keep in mind.
I know, again, guys, during AEP, we like to keep these short and sweet. I do have one more question. I have several questions planned, but it's already 10:16, and we try to keep these between 15 to 20 minutes during AEP. Harry says, should people who have fairly expensive drugs get 3 months medication by mail, or can you even smooth mail order? That's a really great question, Terry. So,
can you use the smoothing provision on mail order?
You can use the smoothing provision on mail order. Yes. It just depends.
Any experience with this?
Oh, I don't know. It's going to be interesting. But yes, you can use the smoothing provision for mail order medications. It's going to truly, I mean, my rule of thumb is that if they're going to hit the $2,000 MOOP by first quarter, then you should enact smoothing.
But you can't, there's nothing you can do now, like at enrollment, right?
Well,
like it's just going to be
I actually don't
January.
know. I actually don't know because I do know some carriers were talking about how they would have the ability to enroll into smoothing at time of application.
Oh, okay.
But I don't know. It's a great question that I don't have the answer to.
But I didn't think we could do that for them.
I think so. I mean, again, it's at time of application. I know. Can you drop out smoothing provision? Yes, we'll get into that. But I think like there is a time to where like an agent, like you can't sign somebody up, but it is a question that will be asked that allows the person to enroll at time of application. I don't know what that looks like. I'm going to be the first. Like I am underprepared for that question. I do not know. Because like Medicare Center, I don't know if that will look different on Medicare Center when you're going through an application, or like Connecture or Sunfire. When you're going through that, will there be a new question about smoothing? I don't know.
We'll find out on the 15th.
I guess so. I want to know before that, though. I'll ask. I'll find out today. I'll let you know.
Maybe I could do like, I could do a test application. Just not submit it.
Yeah, you could.
If there's a question about it.
I'll find out. And Belinda, can you drop out of the smoothing provision? If you are active, if you have a payment plan going on while like smoothing, so like you enrolled into smoothing, You went to the pharmacy in January. You went ahead and enacted smoothing to pay for your medications for January. I don't know what it looks like to opt out of smoothing. I don't know.
So many unknowns.
There's so many unknowns. I don't know what that looks
I have
like.
no idea.
I don't know if it means like, okay, well now you have to just write a lump sum check to the carrier to repay the rest of that medicine, or if it's like, okay, because you can go like you don't have to do smoothing every single time you go to the pharmacy. So I don't, you know what I mean? Like it's not like if you're enrolled into smoothing, you're not automatically smoothing out your medications. You're just turning on the ability to do that. It's at the pharmacy counter where you say, I want to do smoothing or I want to pay for this now.
We've had a couple
I wish my brain was working
We've had a
better
couple
today.
agents ask pharmacist Brian
Yeah.
Headache.
Mm-hmm.
None of this
They have
pharmacists
no idea.
Haven't heard of it.
Haven't even heard of it. They're about to get some fun conferences for 2025. It's gonna
January calls are gonna. If we think deductible calls are crazy, it's
gonna be wild.
Yeah.
Awesome. Appreciate you guys. Again, we'll give you back the rest of your morning. Thank you for joining us. Terry, thank you for your question. We'll be doing more of these. I want to make sure.
On Space Girls.
Space Girls. Let me know what's the deal with Space Girls. I'll send you a video. We'll send out a video. But appreciate you guys so much. We'll see you next Tuesday when it'll be the official start of AEP.
I'll be back next week.
Are you?
Mm-hmm.
Yay! Perfect. So appreciate you guys so very much. We'll continue to do these. We'll continue to do updates. Medicare Center has a ton of really great updates that are dropping, including LIS calculations. They brought in 3 pharmacies now, which is really cool. That's happened. But LIS calculations, the client sorting, things like that, all coming here in the next few days. So more updates to come. Okay. Anything else? Any other words of wisdom? All right. So until next time, guys, have fun.
Make money.
And give impeccable service. Thanks.